Hello everyone, welcome to this live session. Today the topic itself is so exciting. It is positive birthing experience. I'm so much looking forward to talking a lot about it, and we have with us today Chetana Mrunalini. She will be joining us. She's our guest for today, and she is she has been working in this field from the past 11 years. Let me just get in Vidya and Chetna. And yeah, I was talking about Chetna. She's working in this field from the past 11 years. She's trained in Lamaze's philosophy of childbirth preparation. Hi, Vidya. I
Hi.
was just introducing Chetna. I guess she's
Yes.
here. Okay, she's not yet there. Let us wait for a couple of more minutes. Thank you everyone for joining. And as I mentioned, that we will be talking about
She's asking
birthing
how do I
experience.
send the invite?
Let me try to send her and
Yes.
send her a request then.
Yes.
Yeah.
Yeah.
Okay. Oh, she's not having the latest version of Instagram.
Okay, I'll tell her. I'll tell her.
Yeah. Okay. Yeah. So guys, I think it will be a while us, but then still let us try to keep you guys engaged. For all those who have joined, as I mentioned, we will be talking about hi Chetna, I guess you are watching us. I tried to send you a request, but it looks like your Instagram version is not updated. So Instagram is not really letting me send you the request. So if you can update it, it will be great, and then we can connect. In the meanwhile, everyone who has joined the session, please send in your questions. If you have any questions regarding birth, labor, anything at all around this topic, please feel free to post it in the questions box. Okay, so then if you guys see on your screen at the right hand corner, at the below right hand just below at the corner of the screen, you will see there's a question mark. Okay, a comment image with a comment icon with a question mark. So just click on that and post your questions over there. Okay, the only issue if you post directly as a comment on the live session is that we will not really be able to track it because they just disappear with the number of people joining in and the number of comments pouring in. So please send your questions there and we will have them answered by Chetna. And till the time she joins, I'll just try to give some background about her to you guys. Yeah. So Chetna, she's as I said that she's practicing childbirth, from the past 11 years, and she has her own natural birth center, and that's called the name of the natural birth center is the Birth Home. We will be sharing the details about her center later on once we post this live to our feed. And yeah, there's a lot
Yeah.
about her. Yeah, let me
Yes.
just read out a few. Okay, she's here. Great. Yeah. Hi,
Hi.
Meenakshi. I can see you have a question.
Hello,
Hi,
Chetna.
Chetna.
Hi Vidya. Hi Nilüfer.
I'm Nilufer.
I'm Vidya. She's Nilofer.
Sorry, I'm not
I
able
am
to hear.
Vidya. She is Nilofer.
Got it. Yes, I guessed as much. Yeah.
Okay.
Okay.
Yeah. I just went ahead and I introduced you, Chetna, to
Yeah.
everyone who's here today. But still, we would love to hear a few words from you before we start with our questions.
Well, I have been in this journey of birth work for quite a few years now, and I think my inspiration were many women, definitely, but your own birth kind of changes you, right? So that kind of set me off on this path of midwifery. I gave birth to my older child in a freestanding birth center with midwives, and that was a kind of a life-altering experience. And here I am, almost 13 years from that time, doing what I love doing, which is, helping moms and families and helping babies come into this world.
Wow, that was nice.
Amazing.
Yeah, that's so good. Yes.
Yeah, I would
We
love
would
to
like to.
more. Yeah, I would love to hear more about that story, Chetna. But yeah, for now, let's
Sure.
continue with the question. Then,
Yeah.
yeah, I would just love to. Or else, let me ask you, can you give some more details? Like,
Yeah.
what was it? Like, as you said, like, your birth, because I'm intrigued by that. That's the same story we have. That's the same story Vidya has, and it's the same story I have. And, hearing something from another mom who experienced something and decided to make a change, okay, and is making a change
Yeah.
in this world. So we would love to know a little bit more about your experience, if you don't mind, if you would like sharing it.
Of course. I love to share and I love to talk about my experience, no problem at all. Well, I was going to a regular OB, almost till like the first, I think, 15, 16 weeks of my pregnancy. And, I was reading up a lot about natural birth, and that something was, very fascinating, and it drew my attention. But then, I remember very distinctly asking my OB, what's your episiotomy rate? And then she said, no, I think I asked her do you always give epidural to all your patients? And she said something like, yeah, you should totally take an epidural. And it was a very naive question, thinking back now, because I'm on this path. But, as someone who was newly pregnant back then, I was like, maybe she's not the person for me if she's going to give me an epidural, because I had read up about, what are the side effects and all of that. And then a friend of mine who had given birth with midwives a few years before me, she said, I was living in the US back then, so I had access to midwifery care. And she said, why don't you just check out midwives in your area? And then I went and interviewed a few of the midwives, and I was like, fine, this is what I want to do. And definitely there were a lot of people in the family and some of my friends who were also sort of worried that, is this the right path for me? But, after meeting my midwifery team, I was pretty convinced, and my husband was also very, very supportive of the choices that I made. I think it's very important that safety is paramount, right? In any sort of setting where you're giving birth, but you also just need no, I mean, safety is one thing, but you also need to feel completely comfortable, right? And that is what enhances the feeling of being safe, because if at all anybody senses danger, right, any mammal senses danger, they are not going to be able to give birth, right? And unfortunately, we are very often put into situations where there's like bright lights and loud voices and all of those things which are not really conducive for feeling that sense of safety and security and being able to go into your shell, to being able to birth and let your body do what it needs to do. So once I joined, once I changed the practice to join the midwifery team, and there was no looking back. And I had a pretty fast labor actually for a first-time mother. I labored almost for about 24 hours. But the early labor was for 12 hours or so, and then I was in active labor the next morning, and I had my baby in the night. And it was as, I mean, there were some interventions. It wasn't a completely intervention-free birth, but I know that I birthed on my own terms, and I had amazing support from my birth team. So that was, quite an empowering experience, because then you know that your body is capable of doing what it's doing, right? So um, yeah, I think there's no looking back from there.
Yeah. That was so good.
Amazing. Thank
I
you
mean,
so much for
yeah.
sharing that, Chit.
Sure.
Nilüfer, would you like to ask first question?
Yeah, I'll start with the first question and then you can continue with your. Before that, I just want to address to the audience over here. I see there are a few questions which have come up in the question box. Thank you so much for putting your questions over there. We would be answering your questions once we are done with the session. So please have some patience and wait for it, because we have planned something for this session and we would love to cover all the points, because it would really help you if if we have Chetana answer to all of them. As for your personal questions, we will still try to get back to them once we are done with the planned session. Okay, I hope it's fair enough. So I'll start with my first question, Chetana. You know,
Sure.
when we talk about childbirth and labor, okay, the first thing that comes to mind is screaming women, okay, and panicky husband, and a hospital setting, and lots of sweating, where all these things do happen. Of course, there are things that happen, but then that entire image that has been created, which we get to see around us. Through all the influential mediums, okay, including our Bollywood, contributing a lot to it. So that and everything else, okay. So whatever we see and hear that has an influence or impact on us, there is fear around childbirth and labor. Okay, so it's really obvious. I wouldn't blame any first-time mom, any woman who's pregnant to be fearful, because that's the way we have been conditioned. Okay, why do you think
Yeah.
there's so much of fear around this entire birthing experience? Today we are going to talk about positive birthing, which is amazing. But before going into that, let's address the question that why are
Yeah.
women so scared of birthing?
Yeah. Um, I mean, yesterday I posted, I don't know if you guys read the post, but I posted about this experience, postpartum visit I was doing, where this mom, she had a successful VBAC with us, and she was just exclaiming and comparing the first experience where she had a C-section, and how abusive and fearful that whole experience was compared to the second experience, which was truly empowering for her. And that was all like completely unprompted. She just wanted to share what she felt. And as I was sitting and listening to her, thing that struck me, and as I was listening to you as well, the thing that came to my mind is, I think we've just taken birth out of the hands of women, right? And we have just made it a whole medical event, and it's not a medical event, right? We are not always afraid that our stomach is not going to digest our food, or we are not afraid that a regular healthy person will just stop breathing suddenly, right? Because those things can happen. We can have an upset stomach. We can, have, breathing difficulties, or any sort of health issues. But, it doesn't happen on a day-to-day basis, right? It doesn't happen to normal people. And and if births didn't really work, I don't think that, the population will be this populated, right? Like, I mean, the earth will be this populated. It's just that, we need to go back to kind of our basics, and we need to go back to our roots, and just understand that just like how we do our normal daily functions, yeah, birth is also a normal body function. And culturally, somehow that's been completely removed from our consciousness, right? It's not normalized anymore. And all those images that pop up when we think about birth, right? it's definitely influenced by the media, all those screaming women, and then the water's just splashing on the floor, and everyone is like dashing to the hospital. And yeah, I mean, things like that do happen in birth in terms of, like the contractions really coming close and the waters do break and at some point and all of that. But I think what the movies and the all those serials and everything they show is basically transition, right? When the mother's getting ready to push her baby, right? She's fully dilated and the mother's ready to push. That is what they are actually portraying. They are not really portraying the all the work that a woman has to do before that. And of course, it will be too boring for someone to watch. The average length of first-time mother, laboring mother, the average length of labor and birth is about 27 hours, right? That doesn't mean that you're in pain for 27 hours. I think there's also a lot of fear that is generated around the whole concept of the pain of labor, right? So the thing is that the body knows how to do it. We have all the functionality built in beautifully. For years together, it has been honed over and over again. We have hormones which cause these contractions, but we also which cause pain. But we also have hormones which help us forget that pain in between those contractions, right? So we have the oxytocin, which makes the uterus to contract, the waves, the hormones, whatever you'd like to call it. But then we also have endorphins, which are, the happiness hormones, the natural painkillers of the body, which kind of, bring us back into our bodies, make us feel like, okay, there's nothing wrong. It's all fine. Yeah, so I think, just breaking it down for oneself when one is pregnant and, is facing all these different questions and your own thoughts about, what is going to happen in labor and all of that. Whenever there is like that fear that is either created externally or you're having doubts internally, you always have to go back to, if you were to imagine like 4 pillars, right? So if one pillar is doubt, there are 3 other pillars, which could be, love, because you love this baby, you love your partner, you're welcoming this baby into the world with all the love in your heart, right? And then there is the other pillar, which is faith. You need to have faith and trust in, yourself, in your baby, in your partner, in the medical care providing team that you are a part of, right? That is going to be taking care of you and supporting you in birth. And there's also, knowledge. You are, constantly learning new things about your body, about the pregnancy, about what to eat, about what exercise will help you, and what will labor feel like. There are so many resources out there right now. Watching birth videos is a great thing. So whenever you feel like one pillar is growing tall, like the pillar of fear and doubt is growing tall, you can lean on those other 3 pillars and try to bring them up, okay, so that they can all be equalized, right? And then you don't have to concentrate on one of the pillars. You have those 3 other supporting pillars, and you want it to be a sort of a stable situation. So having doubts and fears is natural. I mean, every pregnant woman has it, right? It is an unknown, especially if she's doing it for the first time in her life. She's never done this before. But knowing that, thousands and millions of women have done this before her, right? She can stand in that power. And I think that's where, going back to what is true and what is, evidence-based is a big buzzword, right, in the birth industry and birthing in general. So I think, going back to what is true, going back to what you feel internally, informing your instincts, right? Trusting those instincts that you have, trusting those thoughts that come to you. I think that can help overcome, the fear that one can feel, when faced with multiple things, in your pregnancy, and when you're heading into birth.
Yeah. So much for that. So much. I just want to add one thing. I just want to add one thing over. I just want to back up Chetna by saying that, every word that she said is having so much of meaning to it. And, there are people, like, actually, I get so many questions from people saying that, why to go back to the traditional way of birthing when you have advanced medical care with you. Okay, as she mentioned, I just want people who are having those questions to listen to what she said. Your questions will be answered. And why is birth education necessary now, and why it was not necessary, say 40, 50 years ago? Because that time women knew how to connect with themselves. That instinct was not lost. Over the period of time, we've had so many other influences in our life that, that instinct which women had is somehow being lost in all that noise. So through birth education, you will be able to get that back. You will be able to connect to it back. It's not like, it's gone somewhere. You will be actually able to connect back to it. Thank you so much, Chetna. I hope, what I said makes sense in context. Yeah, yeah, Vidya, please
Yeah,
proceed.
yeah,
Yeah, and I like that pillar concept. Easy to, Yeah.
yeah.
Yeah. So next question is, Chetna, does this fear lead to C-sections, majority of the C-sections? Yeah, there are some medical complications, but does fear add on to that, or is it purely because of health?
Well, according to WHO, the C-sections worldwide, the C-section rate should be less than 15%. Anything above 15% cannot be really justified, right? And I think, the advances in the medical field with respect to birth and surgery and having a surgical way to ensure that the mother and baby are safe are great tools, right? And but is that tool being overused in the current world situation that we are in? Yes, it's definitely being overused a lot. In Bangalore, where I'm from, we do have a lot of hospitals with upwards of 60, 80, some of them even have a 90% C-section rate. I think we are actually, fear definitely there, but I think we as a society are failing our women, right? Failing our families by not giving them the opportunity to and who are we also, right, to give anybody an opportunity? Like, we basically have to set up conditions and institutions and centers, or even, allow women to follow what needs to be followed in terms of, having labor start naturally, right? When we hear of routine inductions happening at around 38 weeks, sometimes even 37 weeks. Nobody waits for the due date. A lot of the OBs do believe that Indian women cannot wait for beyond 40 weeks. It's only a thing for Western women. But that's not really based in any sort of evidence or research. There's nothing that is actually saying that one cannot wait, especially for a first mother. Most first-time mothers actually give birth after their due date. Like 5% of babies are born on their expected due date. Maybe about 60, upwards of 60% of babies are born after their due date, and some percentage are born before their due date. So the idea is that when the mother's labor starts on its own, right? Then she's working with her body. Her baby is working with all the sensations that of labor that even the baby feels, and then she's there's a higher rate of successful natural birth. But then when we start medical interventions even before labor starts, right? Then very often, like, upwards of 50% of inductions result in C-sections. And also, how much time, as I said, the first time mother's average length of labor is about 27 hours. So do hospitals wait for 27 hours? I don't know. Some may, and some may not, right? It depends on what's happening, definitely. We also don't provide individualized care. it's sort of like a conveyor belt system, and everybody just should, basically their labor should progress in the exact same manner, which is very, very unlikely, right? That's where I think, we've set up all the systems to make sure that, a birthing mother, somehow if she makes it through it and has a vaginal birth, it's like she's a hero, right? Pretty much, that's how it's become. Yeah, it's just very sort of unfortunate that we have reached this stage, and we are trying, like a lot of people are also trying. The childbirth educators are trying, and then the doulas are trying, the midwives who are here in India, they're trying. There are definitely some OBs who are trying to change that. And but I really think, like, the driving force should also be the people who are pregnant, right? If they ask, or if they say that, no, I don't want a vaginal exam at 38 weeks. No, I don't want to be induced, before my due date, for a non-medical reason, right? If there's a medical reason for induction, yes. I mean, induction is a great tool when, if the baby is not doing so great inside and would be better outside the womb, yes. But then how many of those situations actually occur, right? Yeah, so if there's no medical reason to use an intervention, right? A more hands-off approach where, you're supporting the physiology of birth, where birth unfolds as undisturbed as possible. That would be a situation that, I truly hope can come in the next few years or next few generations. Yeah.
Yeah, actually, we hope to. C-section is not a minor surgery. It is a major
It's not.
surgery.
Yeah.
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 It's
Yeah,
maybe
and
it's
once
okay.
you have that first C-section, you always carry that risk from the surgery, right? I mean, and it doesn't go away. Even how many ever times you get pregnant, the risk, in fact, keeps increasing. And again, the other problem that a lot of women face here is that there are not too many providers who support a vaginal birth after the primary C-section, right? So, I mean, a lot of people talk about it, but also I think there is not enough support even for the medical staff, even for the OBs, to actually, that's the thing, right? OBs are surgeons, obstetricians. When I say OBs, they are the doctors, right, who attend the births, right? So they are surgeons. They are trained to, to solve problems when they happen in labor and birth, right, or in pregnancy or in the postpartum period. And they're very, very good at it. I mean, we have amazing surgeons who do great C-sections, and they're very, very well qualified as well. But then we need experts in normal, right? And midwives are experts in normal. So we definitely, I mean, the need of the hour is like more and more midwives, right? So that midwifery care in and of itself is providing individualized care, and that can take a lot of fear out of the whole the whole birthing situation, I would say. Yeah.
Yeah, actually, my next question overlaps a little with this one.
Yeah.
But yeah, so there are mothers who actually go and who try for vaginal birth or natural birth, but end up in C-section, and they really feel bad. It's like they wanted to do something else and they ended up doing something
Yeah.
else.
Yeah.
So how can they bring in a positive experience during this time?
Yeah. So I think it's about knowing what to expect, and it's also kind of setting the right expectations for yourself, right? So one of the things we do talk about, I mean, although ours is a natural birth center and I offer natural births as a part of it, we we also talk about C-section. We also talk about what would happen if you don't have a natural birth, right? So I think being aware of the different situations in general, right? And this is something that's very commonly discussed, right? Having a birth plan. But a birth plan doesn't quite cut it, because a plan is something that we think we can control, but birth is not something we can control, right? And we really have made birth into a sort of a thinking process, right? And it cannot be a thinking process. There's no hole big enough in our brain to give birth. It has to come out of our body. The baby has to be born out of our body, right? Um, so, yeah, so that's why it's very important to sort of know to have multiple birth plans. In fact, what if the first plan doesn't work? How can I, kind of reset my expectations and go along the second plan? What if the second plan doesn't work for whatever reason, right? Like, so let's say first plan is all about being natural, completely, I'm doing it with myself, with my body and all of that. The second plan could be that I need more help and more support. I might need, pain medications if my labor is long and, I'm having like terrible back pain. Like maybe need some other interventions to be able to birth my baby. And the third plan could be that, I end up having a C-section because, either the baby didn't like labor or my body was not, okay during the whole labor process, which is usually, either the mother's, BP shooting up, she's getting like, extremely dehydrated. I mean, there are ways to solve each situation. I can't really get into the technicalities of why one would have a C-section because it's so individual, each situation. But in general, I would say that, setting the right expectations for yourself and knowing what your choices are and being able to find care providers, which I think is like finding a little bit like finding a unicorn, because you need finding a care provider who is actually giving you all the information, giving you all the options, helping you make the decision that is appropriate for your situation. That is something that can change, the perception that a woman has after her birth. There are a lot of women who have normal births, vaginal births, but also feel traumatized after that. Also still feel like a failure because, India, most, hospitals in India, they still perform episiotomies, which is, opening, widening the vaginal opening while the mother is pushing, right? They cut. And that has been, most of the other countries, especially in the West, have sort of stopped doing it on a routine basis. So doctors don't do it. And this evidence has been there for almost 15 years, upwards of 15 years, that routine episiotomy is not required in birth. And it causes more problem and does more harm to the mother than good. Yeah, so a lot of women, even if they end up having vaginal births, are traumatized because they have episiotomies. And I know women whose episiotomies took upwards of, 3 months, sometimes 6 months, even 1 year to completely heal. And they never feel like, okay again about it, right? It's a very traumatic experience. So again, it is somehow it's like the odds are stacked against a lot of birthing women. But knowing what you want and actually negotiating. I mean, we are not here to fight with the system, right? We are here to negotiate with the system and say, okay, this is what I'd like to do. This is what I want. What are your thoughts about it? And we do lean into experts to tell us that everything is okay with us and everything is okay with the baby. But also checking in really deep within ourselves and knowing what we want. That can make a big difference, I think.
Yeah, that was so nice actually to listen to. Yeah, the thing is, I mean, natural birth kind of, it was a very common thing in India, ancient times, but now the West is following certain things of India and we are trying to follow from West. Somehow we are again trying to, go back to our own roots. It's all,
yeah.
yeah.
Obstetrics did start in in the West, and yeah, it's kind of here. And I'm really great and thankful for the advances, right, in medicine. But yeah, can it be more women centric and family centric? Can it be more respectful care? Can it be more individualized? I think the answer is yes. Yeah.
Yeah, actually, I have only one question left, Nilufar, so maybe we can take up audience questions now and then ask the
Yeah,
last one.
sure. Yeah, before we even go to the audience questions, Chetna, can you please let us know a little bit more about your birth center, so that the people who are watching this session, and also usually we get a lot of views after we post it to our feed. So everybody who watches this, uh, knows a little bit more about your center and where it is located and what, more about, how you go about it. Like maybe not complete detail, but just a brief kind of thing so that people get to know. Yeah. Yeah.
Yeah. Well, so we started this center called as the Birth Home in 2019, and we are, we were a bunch of passionate birth workers who got together and said that we have to change something in Bangalore, and other cities have birth centers. So why is Bangalore sort of lagging behind? So let's do it. And we have been operational since 2019, and we had a good 3.5 years run. We actually closed down the center just on the 31st of Jan. So sorry to just drop it like a bomb there, but it's something that we decided to do together as partners to not continue with the center. But
I thought
as
you shifted. Sorry, I thought you shifted.
no,
Not,
no, no.
uh,
No, so we closed down our operations. Yeah, and
okay.
it was just like literally 2 days ago that we closed down operations. So we till end of Jan, but we are sort of not doing that anymore. I am continuing to provide care and to support families through their pregnancy, birth, and postpartum journeys. So I would encourage anyone, if they want help, please do reach out to me, and I'll try my level best to help. I'm still trying to figure out my next steps with respect to where the birth will happen and all of that. I do have a few leads and ideas, so that is something I can discuss with. But the way I would still like to talk about what we did. The way we operated was that we took on clients who were healthy and low risk, which meant that and also people who are committed for this kind of care, right? Having natural birth is going through quite a lot of pain. Yeah, there's no way around it, but it's also manageable. It's also something that can be, you can learn ways to cope with that, right? And this is something that we did over and over again, and we have had so many clients walk through our doors and been very happy with the care that we provided, because they felt that they were heard. We answered everyone's questions, whatever questions they had. They were so committed. They took the childbirth classes. They did all the exercises they recommended. They ate all the nice things. They took really good care of themselves. And all these families were also families which were deep rooted in the belief that birth is natural, and it's a natural body function, and our bodies are meant to do this. And some had straightforward births, and some had long births, right? We've had births in our center where, I mean, really fast births where it was like she came in pushing, and in 20 minutes, one of our clients had a baby. And there have been births where, the mother had labored for almost 3-4 days before giving birth. But that's the thing, as long as, both the mother and baby are safe, right? There's no reason why we should put any sort of time limits, right? So I think in addition to the safety, there's another aspect that we keep constantly checking in on is progress. Is there progress? Slow progress is not a problem, but there should be progress, right? So as long as these are happening, then there is no reason why we should, hold back a mother who is having these contractions and doing what it takes to birth her baby. Yeah.
That's
Yeah, thank
so
you
nice
so
to
much
know
for
about
that.
it. Yes. I really thought you shifted to Indranagar. I didn't think. Yeah.
Yeah. I didn't get around to telling because I've been kind of busy with the whole logistical part of, finishing off the last few births and, getting everything done, wrapped up. Yeah.
It must have been an emotional journey for you, Chetana.
It is, and my request to the community and all your followers from Bangalore is, if you want to make this reality, you can. I mean, it's really in your hands. You build another center and employ me. I would be more than happy to come and work.
Yeah.
Yes. So guys, watching this session and everyone will watch later. If you're interested in learning more about positive birthing experience, even if you've not made up your mind, because it's not really easy to straight away make up your mind. Some people are there who do make up their minds back on, but then it's okay. Even if you're having some doubts or something, you guys can reach out to Chetna at her Instagram handle, which we will be sharing along with this post on our feed, and she should be able to answer all your questions. In case if you're not able to reach her or find her, message to us and we will redirect you guys to her. Yeah, thank you so much for that, Chetna. And I'll just read out a few questions which we received during the session. The first one is from Minakshi. She's asking, it's been 1.5 months since she's delivered normally. I'm expecting she's delivered vaginally, but still not getting recovered. So just hold on 1 minute, Chetna, before answering that. She has a few more questions, so maybe it will all make sense together. She said her labor was for 15 hours. She got one cut for delivery, not understanding why I'm not feeling that much strength. Also, my stitches are not healing properly. Yeah. I couldn't get the entire question, exactly what she's asking. But if you got hold of it, you can.
I mean, I think she's talking about the episiotomy because, as I was saying, it does take a while to heal, I think it depends on how much one loses blood after giving birth, and also what your hemoglobin status was before, towards the end of your pregnancy. All of that can make one feel tired, right? I think she's having fatigue. So I think if you could get some blood work done where you test your iron levels, that might be one of the clues to why you're feeling so tired. With respect to the episiotomy healing, it does take some time. Some of the things that may help you is doing a lot of cold packs and alternating it with heat actually. So if she's given birth like 2 months back, right? So actually at this point of time, maybe an infrared light, you can use an infrared light to help heal the episiotomy stitches. And the one thing that you do need to make sure is you go back to your care provider and make sure that it is not infected. I think you wouldn't be, asking this question here if there was a chance of infection. But yeah, as I said, the healing process unfortunately does take longer in an episiotomy. So infrared light and taking a lot of rest, avoiding sitting on your bottom for long hours. I know that most women sit up and breastfeed their babies, but generally for people who have had episiotomies and C-section, it can help to lie down and nurse your baby. So you're not like putting direct pressure on your bottom in case of episiotomy, and not putting pressure on the C-section sutures, right? In case of a surgical birth. So I hope you get better soon, and yeah, my wishes are with you.
Same. There's one other question. Okay, I didn't get the person who has asked it. I didn't get her name, but the question is that I guess she's still pregnant, so she's asking this. That like if she chooses for natural birth, and she wants to know if there is some kind of backup system available in case she is in case there are any complications, any medical complications.
Yeah. So the way it worked when we were operating the birth home was that we always had, the reason why birth home was where it was because it was close enough to our backup, next level of medical facility that is needed. The thing with natural birth and the way it worked at the birth home is that, it's not, we always, get to know our clients pretty well before they, decide to give birth with us, and they get to know us pretty well. So as I said, if you're healthy and if you're low risk, you're doing all the things to do, you do stand a very good chance of having a normal natural birth, right? But again, things are unpredictable. And if in case either the mother or baby has complications that arise, the one thing that everybody needs to know is complications does not equal emergency. Okay, and again, these media images that we have in our minds where everything is a rush, and it has to happen. Even if there is a complication, what we would do in our center was stabilize, try to bring the complication back to normal. And sometimes it would resolve at the center and there was no need for a transfer. And sometimes, stabilizing was what we would do, and then we would go to the hospital, where most likely it would be for a C-section, because that was the only time we would transfer for, a surgical birth at the next higher level of care. So we had all of those systems in place. And right now, after closing the birth home, my plan is to, actually have, support clients in the facility with an OT, right? So then there is no need for like moving, facilities if in case you need the next higher level care. Yeah.
Wow, that sounds amazing, Chetna, actually, helping them out. So, do hospitals have such facility wherein they let midwives, be present with the patient, and then only if there's need, there's medical intervention? Do we have such a thing in India? Because I'm not aware of it, that we have anything like this.
I mean, increasingly, I think, doulas are definitely part of the system, and they are, they're definitely independent practitioners, and they go attend births and support clients in labor. This is something that I am trying to explore and see if, I can support my clients better. Yeah, so since I don't have, thank you. Since I don't have a center anymore where natural births can happen, I mean, why don't we take natural births to hospitals, right? So that's really my hope.
Amazing, that's amazing. That's seriously amazing.
Yeah. Yeah, the system's already exists.
Great initiative, Chetna. Great initiative. Yes. I really hope, from the bottom of my heart, I pray that you succeed in this, this initiative started. Yeah, and really, proud of you for doing this. I think this is something that's going to be a game changer. The woman who's there will have that kind of see, more than the woman, what I feel, the family intervenes too much. There are the parents, the in-laws, the husband, maybe for some reason
they're all well-meaning, but
sorry,
I said they're all well-meaning, but they're also I think
they're not well-meaning, but then they're more scared and things like that. But if this initiative of yours works, then it's a win-win. It's kind of a win-win-win. Like everybody wins in that situation. So I just hope it works.
Yeah.
And definitely we'll keep in touch with you. It would be great to see you succeed in this venture. Thank you so much.
Yeah.
There's one more question we have. There's just one more question before I end, the questions from the users. So it's Dr. Shamili Vidsha asking that how much hemoglobin should be there before delivery. I'm actually expecting in another 1 month, mandatory thing to be done for normal delivery. So she's expecting her baby the next month. Please proceed.
Anything about 10.5 is okay, but That's like the lower level of normal. What one should keep in mind is that the hemoglobin naturally dips between the second and the third trimester, and that's actually a good sign. So you may start off with a high hemoglobin in your first trimester, and then it sort of starts to dip in the beginning of the third trimester. It means that your blood has expanded in volume. So that's one of the things that happens in pregnancy. So there is almost double the volume of blood in your body at the end of the pregnancy, because that's how much blood the placenta needs to make sure that all the nutrients go to the baby, and that is how much blood we have, so that, in case there is a little more bleeding than what is normal after birth, we are not in some sort of a deficit, right? And we are able to still function and take care of our baby and take care of ourselves and recover from birth, right? So I think our nature in all its wisdom and our body in all its wisdom has all these checks and balances in place. So when the hemoglobin does dip, in the beginning of the third trimester at around 28 weeks, there's usually another level of blood test that most care providers order, where they see that there's the dip. Because if the dip doesn't happen, it means that, something is not normal, right? So we actually want to see that dip in the hemoglobin. And then, other testing may be ordered to see if there's a raise. So, having good iron-rich foods, cooking in cast iron vessels, and also taking a good quality iron supplement, those can really make a big difference. So that, having iron is not just to increase the hemoglobin. The hemoglobin also depends on other cofactors of iron, which is, vitamin B12, vitamin D3, magnesium, vitamin K2. There are so many things. So having as wide a variety of foods that you can in your diet, so that you get all the necessary, nutrients, and also going out in the sun, right? Checking your vitamin D levels in pregnancy, that makes a huge difference in, having a smoother labor and recovery in the postpartum. All of that makes a huge, huge difference.
Thank you so much. Thank you so much for that, Chetana. Actually, we've got more questions now, but I don't think we will be able to answer all of them. What we can do is, guys, I'm so sorry, because Instagram has 1 hour limit. If we don't close our session before 1 hour, we will get disconnected, and I would not even be able to post this on the feed. So what I've done is I've noted down your questions, everyone, and we will be posting your questions on our feed, and we will let Chetana answer them. Okay, so I guess that should work.
Sure, I would love to do that.
Yeah, so we'll do that, and I'll leave it to you, Vidya. If you have anything more, or we can wrap up, because we've just got last 5 minutes.
Yes. Yeah. Quickly, Chetana, can you please suggest your suggestions for expecting mothers who are watching or who will watch it later?
Well, as I think I've been kind of saying all along, I would say go deep down within and really check in and see what is it that you want for this particular baby, for this particular birth, and for yourself, very importantly, and see what kind of support systems you have around you. Don't hesitate to change your doctor if it's not working out for you. There are many, many doctors, especially if you're in a city, you have access to a lot of doctors. If you do have access to midwifery care in the place that you stay, go check them out. It is completely your choice. You should, be okay with what you choose ultimately, right? You're the one living with the consequences of what happens, right? So don't hesitate to ask questions. And if someone is not answering your questions truthfully or not wanting to listen to your question fully, then that's definitely like a red flag. Educate yourself, read as much as possible, watch normal birth videos, right? There's so many nowadays on Insta and so many YouTube videos, and they're like so many resources right now. And the one thing that I would like to sort of say is, eat dates every day. And there's a research paper that came out a few years back which says that eating dates on a daily basis can improve your chance of having a smooth labor and birth. So eat dates. Wet
Starting
dates.
from the third trimester, or is it okay to start eating dates? That's one question. Yeah, because we I've also posted something about dates, but I posted it saying start eating it from your third trimester. So it's second trimester.
Yeah.
Okay. Thank you so much.
Second trimester, you can eat about 2 to 4 dates every day, and then in your third trimester, you can double it. You can eat 4 to 6.
Okay.
Or maybe even.
Thank you so much for that amazing tip and for all the lovely answers you had and so patiently replying to all our questions, Chetana. It was lovely knowing you, and I'm sure this would help.
I really enjoyed.
Yeah.
Yeah.
Thank you so much.
Thank you so much.
Yeah. All right. Bye. Good night.
Bye.
Bye.
Good night.